So I'm here today to present a tried and true program called the PEP program, also called the FIFA 11 Plus, which is about 20 to 25 minutes of exercises that are done 3 times a week as a warm-up, which have been shown clinically and scientifically proven to prevent ACL injuries. The ACL program has 5 components. It involves a warm-up, stretching, strengthening, sports agility specific exercises, and plyometrics. The video that we're going to show will go through each exercise in each section and show you how to properly perform the exercise. The warm-up has 3 different exercises. One is a frontward jog, line to line. The second one is a backward jog, line to line. And the third is a shuttle run. The stretching program involves 5 different stretches. The first one is a calf stretch. The second one is a quadricep stretch. The third one is a hurdler stretch to stretch out your hamstrings. The fourth one is an inner thigh stretch. And the fifth one is a hip flexor stretch. The strengthening program has 2 major components. One is a walking lunge, and the single one is single leg calf raises. The agility section of the program involves 3 components. One is a forward run with a slow deceleration and changing direction. The second one is a lateral run with deceleration and changing direction. And the third one is a bounding run. The plyometrics has 5 different exercises. The first one is lateral hops, either over a cone or just the line on the field or in the gym. Frontward, backward hops that are done over a cone or a line in the gym. Single leg hops. So the first one is a front hop, the second one is a backward hop, and then the third one is a single leg hop. The fourth exercise is a vertical jump where you're just jumping up and down, and the fifth exercise is a scissor jump. If you've had an ACL injury, the ACL Prevention Program will help you from getting a second ACL injury. There was a study where they had 2 groups of athletes. The first group had an ACL injury and did an ACL prevention program after their surgery and returned to sport. The second group had an ACL injury and surgery but did not do an ACL prevention program after returning back to sport. What they found was the group that had ACL surgery that did the ACL prevention program had a 5 times less recurrent rate of an ACL injury compared to the group that had ACL injury, had surgery, went back to sport, but did not do a prevention program. So even for the athletes that have had an ACL injury with surgery, the ACL prevention program is helpful to them. Study after study has shown at least a 50% reduction in an ACL injury in athletes who've never had an ACL tear that undergo an ACL prevention program compared to athletes that do not. It is so important in this time and date and age for any athlete who is planning on playing a high-risk sport for ACL injury, such as soccer, basketball, lacrosse, football, they should be involved in an ACL prevention program. It's so easy. It's only 20 minutes 3 times a week. Use it as a warm-up and reduce your athlete's rate of ACL injury at least 50%. If you have an ACL injury, which most orthopedists consider a devastating knee injury, 50% of the time you will tear either the medial meniscus or the lateral meniscus. You have 2 menisci in your knee. A medial one, which is located on the inner part of your knee, and a lateral meniscus, which is on the outer half of your knee. So 50% of the time, in addition to tearing the major ligament in your knee, you're also going to tear one of the shock absorbers in your knee. And almost every single time you tear your ACL, you are going to damage or bruise the cartilage in your knee joint, the articular cartilage that covers the ends of the bone. And we think that's why patients who tear their ACL have an early onset of osteoarthritis. So in addition to it being a devastating injury to the knee joint itself, there's also a major psychological component to having an ACL injury. Most athletes will not be allowed to return back to their sport for at least 5 to 6 months after ACL reconstruction. So what happens is you have an athlete who plays volleyball year-round. They play for their school, they play for their travel team. When they're not playing, they're conditioning with their team. Then all of a sudden, they can't play volleyball for 5 or 6 months. They're pulled out of their social circle. They don't have that group of friends that they're used to hanging out with. Their routine is completely changed. They're used to doing fitness on a regular basis. All of a sudden, that is changed. So it's not only a devastating injury to the knee, but from a psychological perspective, it's really hard on the athlete, especially when you have a teenage athlete, which is where these commonly occur.